Good evening, everyone. Welcome to the third of 3 Plugged into Energy Research lectures hosted by the University of Rhode Island College of the Environment and Life Sciences, and in particular, Cooperative Extension, which is who I am here representing. My name is Kate Venturini. I am a program administrator for a number of our outreach programs and extension here in Rhode Island, and I'm very pleased to present to you an amazing lecture that we've curated called Barriers to Energy Efficiency in Rental and Affordable Housing. We have some great speakers and experts joining us here tonight, and I'd like to thank all of you for joining us at home. I want to direct your attention to 2 features in the WebEx meeting. One is the chat function, which we'd love if you entered your name and affiliation and location in the chat box there. We can see who's joining us. And then also there's a Q&A function. If you click the small 3 dots in the bottom right hand of your screen, you'll see an option to open the Q&A. And that's where we would love to see questions for each of our speakers, which we will take after they all give their remarks. So again, tonight we have a great slate of presenters, and I want to introduce Ariel Drahobel, who will serve as our moderator this evening. Ariel is the local policy manager for energy equity for the American Council for an Energy Efficient Economy, which those of you are probably familiar with, also fondly known as ACEEE. Ariel is a manager on ACEE's local policy team, where she leads work related to energy equity, energy affordability, and utility-led low-income energy efficiency programs. She provides direct policy and research assistance to utilities, local governments, community-based organizations, and others who are working to advance energy affordability policies and programs. We're very grateful to Ariel, who you will hear from in a bit, for moderating on our behalf. And so without further ado, I will introduce Laura Schauer. She is the Vice President of Illume Advising, who we found after we became familiar with a report that Illume had written on behalf of the state of Massachusetts, which Laura will talk more about. We're very excited to have her sharing her knowledge and passion for this important work that she does. So just a little bit about Laura, and then I will introduce her. Laura spent over 20 years of her career providing research and evaluation services to utilities, public service commissions, and private organizations. She has a specific passion and focus on income qualified and other underserved and or more challenging to reach populations. And over the years, she's led over a dozen studies related to low income and rental populations. And Laura has also authored papers on these topics for organizations including the International Energy Program Evaluation Conference, or IEPEC, the Association for Energy Service Professionals, AESP, and the American Consortium for an Energy Efficient Economy, ACEEE. So without further ado, Laura, you may share your screen and take it away.
Awesome. Thank you so much. Can you hear me okay? Okay, just making sure. While I am pulling up the presentation, I just want to first say thank you to the University of Rhode Island and everyone who's here. I'm really grateful to be part of this conversation. It is so important. And I'm really grateful to be able to present all the good work that Massachusetts has done on this topic. So without further ado, in my time, so a little bit just quickly about Illume. We're a research consultancy that's, we're across the nation. I personally am from Madison, Wisconsin. If you hear any sort of accent, which is pretty common, that's where it's coming from. We have been working a lot over the past few years around issues around equity and disadvantaged communities, pulling our data science and social science research to inform programs and policies around that. So this is a really important and relevant topic for us right now. I want to give a little bit of background about the Massachusetts non-participant study, starting with a huge kudos to the Massachusetts program administrators and the Energy Efficiency Advisory Council consultants, as well as the state as a whole for investing in this. This study was enlisted as a result of their 3-year filing. It was actually a requirement that they take a look and understand better who the non-participants are and through a characterization, as well as thinking through the barriers to participation. But this is something they've been thinking about for quite a long time already. And at this point, when they engaged us for this work under contract with Guidehouse, they're like, you know what, we have this opportunity, let's really do it right, let's do it as well as possible, and let's figure this out. And so they put, as I'll talk about in just a minute, they put a lot of emphasis on data quality and really innovative research to get at these questions. And through that, we thought through some engagement opportunities. I want to say I'm really excited to have all the panelists to hear from them and their thinking on this. We touched the tip of the iceberg on engagement opportunities, a lot because the Massachusetts PAs, program administrators, they do a lot of work internally. So we just took the research that we had and provide some a little bit of guidance, but they're doing a lot of work right now to think through this. This is a really important and useful conversation because the study specifically focused on renters, focused on moderate income, and just so you all know, moderate income is those from 60 to 80% of state median income, Massachusetts specifically, and non-English speakers. And so we really tried to dig into these groups, and hopefully I'll be able to pull that to bear in today's conversation. One thing I wanted to do is define non-participants and what do we mean by that, because there's lots of different definitions to non-participants. And in this case, we're talking about buildings and people that didn't receive anything through their umbrella Mass Save Energy Efficiency program. If they even received an audit or assessment, they are a participant. So when we're talking about participation, we're not thinking through depth of service. And I think that's an important clarification because that's a whole other look that we could be doing. The other thing I just want to do is, a little spoiler alert, is just kind of tee up the fact that when we thought through this, we really needed to think through the fact that people are really complex and multidimensional, and these issues are really intersectional. Even though we're talking about renters here and we're focusing on that, they as a group are not, they're just not one group. There's a lot of issues within this rental group and this rental market. And we need to think about them really thinking through as people and zooming out and addressing these issues pretty holistically. So I'll pull that in just a little bit. Really quickly on the methodology, these numbers actually probably don't tell the story around how robust the study was as a whole. We did over 1,600 surveys, and we used a study methodology that is commonly used by, for those of you who are social scientists, Don Dillman or the census, where we really use a lot of multi-mode research to get at them from all different angles. We did web, we did telephone to non-responders, abbreviated mail survey with a pre-incentive, and we went even door-to-door to meet those that are in the highest non-participating areas, that were not with the highest non-responsive areas. And we targeted truly non-participants along with some participants, but we really oversampled those non-participant groups so that they'd be represented in this study, which we found was really challenging. It's challenging to get them in. It's challenging to actually get them to respond to a survey. We also did customer interviews. These were probably the most insightful components of our study because we were able to stop and really, we did intercept surveys around community action organizations and community spaces where we were able to just get them in their place and talk to them. And those were so insightful. I'll share a case study with that in a few minutes. We spoke with property managers and the PAs themselves, as well as super importantly, the community organizations. And when we spoke with these community organizations, we really targeted those that service the groups of interest, and they were invaluable for us, and we appreciated every moment they gave us. All right, so this is what we're here to talk about, the barriers and opportunities from this market. I'm going to share with you first really quickly the quantitative survey results, as well as then followed by the qualitative. So I don't think any of this will be very surprising to anyone to see that non-participants are more likely to be renters. And I will actually say that this percentage here is probably understated because we had a whole lot of returned mail and bounce backs that as we dug into it, they were part of multi-unit buildings that were most likely to be renters. There's huge mobility issues. My guess is we're underrepresenting the non-participant percentage that's renters alone. The second block, they're more likely to live in 3 to 9 unit, multi-unit buildings, and that's really juxtaposed by the larger 10+ unit buildings. We talk about multifamily buildings and the importance of getting into them. Massachusetts has done a lot of work and done actually, based on this analysis, really well to get into the larger units. And when we did research studies in Massachusetts related specifically to low-income programs, what we heard was there's really challenging getting those smaller multi-unit buildings for lots of different reasons, and that really bore out in this research. Not surprisingly, they're low to moderate income, and I would say this is driven more by low income. Moderate income tends to have pretty equal participation and non-participation rates, and speak a language other than English. I wish we could get into this. I think this is a really important last piece. And again, I think this is way understated because I don't actually think we got to a lot of the population to be incredibly representative of this group. But it really came out that these non-English speakers in need non-participants and highly renters. Moving to the barriers, a lot of this came from the qualitative research and the intercept surveys and the interviews themselves. And some of it will look really familiar to those of you who have been in this research and this space for a long time. It was enlightening and it gave us really some great depth to think through. So the first is landlords. Landlords are an issue with a lot of these folks. There's a really general distrust, there's rent control, negative relationships, unable to obtain consent, which we see as an issue and another barrier. One of the stories we heard was someone actually did participate in Mass Save and she replaced her refrigerator and she got in trouble for it and she had to pay the money for it. It was a real issue because that was the landlord's property. So landlords are definitely a barrier for participation, and unfortunately we're trying to deal with this push-pull model. We want the renters to go to them to get the landlords to do it as well. So it's a challenge. It's not my problem. I mean, it's not, this is the landlord's property. It is not my issue. I don't need to deal with it. If they want to improve it, they need to improve it. That was probably the most prevalent thing we heard from this group. This third one, and again, I really wish I could hit on this more, but it is in the report. They don't believe that they're eligible, and I'll expand that to really truly not understanding. We do a lot of studies around awareness and saying, are you aware? We don't do a lot of studies to figure out, even if aware, do they really get it? And one of the things we heard a lot of is, I don't think I'm even eligible. There's no reason why I'd be eligible. So to them, it's not even relevant. It doesn't even pertain to them. Participation barriers is a really big one. If you look and work within this market, you know that it can be pretty complex to participate. And, time is a cost. And there's a lot going on. Ariel was talking about the energy burden and all that, and that's a really big issue. There's a lot of things happening in their world, and if there's a lot of work in the participation process, that's challenging to overcome. On the property manager side, there were a few things that came out. The first, and I labeled it lack of engagement, but from a positive end, it's like once you got them, you got them. And what I'm saying is we found that once we had landlords, property managers, property owners who had actually participated, they were much more likely to repeat participation, which is awesome, but it's getting them in and figuring out how to do that that was important. And we really have to recognize that this is a business. It's an investment for them and they have return on investment needs. And we really heard that from the smaller group, the ones that we found would be most challenging to reach, that they really, they were unclear about the value proposition. All right, I want to pull this back into reality. And that is that people are really complex. And there's all these things happening in their life beyond just energy. And we're trying to figure out the energy and clean energy space, but they have a whole lot of things happening. The rental market is dynamic. They've got rent, they've got business needs and objectives. And, quite frankly, some of them are just nervous. There's code compliance issues. There's a whole lot of things happening there. And when you're trying to mesh those two together, that's like bringing two worlds together for a common purpose, which is really challenging. And I put here the story of Matthew, and this is in the report. You can read it if you go to it. But in short, he was recently incarcerated. He just is now back into society, thinking through how to get a job. He has a son. He's trying to gain custody. His rent is $850. He's trying to, figure out how he can pay that rent. And here we are as researchers, and we say, wow, that's really great to hear. I'm just really curious. Do you know about Mass Save, and would you ever be interested in participating in an energy efficiency program? And I just want to say, like, for him, that's just nowhere near even anything that he's thinking about. And even though his story may be unique, the situation is not unique. And for many of these renters, like, the relevance and the importance and the cost of them is not there. And these are really hard issues for us to grapple with. So as we, I think we need to start really evolving how we approach them. And that evolution really takes thought work and resources. And that's really, something that we need to think through, especially as we continue to talk about the importance of reaching these groups. They're called hard to reach for a very, very good reason. Finally, just really quickly, some of these opportunities, I'll just touch on them briefly, and I'm excited to hear others and what they have to say today. I think some of these will be pretty intuitive. The report has more, but housing authorities, condo associations. I know Rhode Island is really working to get into those condo associations. Anything related to that is obviously an opportunity. Community connectors are super important. One of the things I didn't highlight in here that really came out clear was the importance of trust. And we as an industry are really trying to reframe this and get in there and work through the communities, which is super exciting. Property managers, landlords, B2B, trying to figure out overcoming that barrier within those managers. And I just want to say design thinking. And if you, happy to cover off, what we mean by design thinking in the Q&A, but essentially it's bringing a group of diverse people together to really take a problem and a challenge and think through it innovatively and creatively, and doing so with an eye to really bringing everyone together and treating everyone equitably as well. There's a whole frame of thinking around this. I think I'm up to my 10 minutes, I believe. I want to say thank you to the Massachusetts Program Administrators for letting me speak on their behalf on this important study. The Massachusetts Energy Efficiency Advisory Council, University of Rhode Island, and the EERMC. And I just want to also note, just briefly, that I know Rhode Island is looking to do something similar through National Grid. I believe I saw something as well as a multifamily census study. So in terms of where you all are in Rhode Island, I think you have some really great work ahead of you, and I'm excited to see what comes out of it.
Awesome. Thank you so much, Laura, for sharing that research. It was super interesting. We have time for 5 minutes of questions. A few have come in through the Q&A already. One person asks, Susan Gorlick asks, if you can clarify what you mean by qualitative results from your study. And also another question from her as well on how you selected the subjects or communities in this study.
Awesome questions. And I'm so glad you asked it about qualitative. In my 5,000 practices, I did define it in about 3 of them. So quantitative is really when we try to take data and be able to extrapolate it to a full population. So we use statistical sampling and using scientific methods. And so we can feel confident that when we're representing it, it's representing a population of interest. Qualitative is more in depth, and you can't necessarily represent that to a population of interest. It's possible, but it's meant to bring a lot of context, depth, and story around and within the research. So I hope that answers the question and sufficient. That's just like my really quick answer to that one. On the how did we target the groups? What we did is we prioritized census tracts by participation rates. And we prioritized areas with the highest levels of non-participation. It was actually a pretty complex sampling strategy, but in essence, what we really wanted to do is focus on those areas of high non-participation rates so that we could make sure that they were in our study. We did include areas that had high participation rates as well, and we weighted the results on the back end, so we were able to do some comparisons, but that's essentially how we attempted to target our respondents.
Great. I received a question privately through the chat, which I will ask you, and then I think we'll probably need to move on. But
Okay.
someone asks if you could expand on some examples of specific aspects of the participation process that are barriers. So if you like, what some of those barriers were that you identified in the study.
Yeah. Great question. We did not actually look at doing like a customer journey process, which we would do under other circumstances. But just off the top of my head, I mean, even just having to get landlord approval for someone to come into their unit is probably a barrier. It's part of the process. Having to get landlord signatures on things, probably part of the process. How it's able to be submitted and getting through that and all the questions that are being asked as well, I think it's really worth looking at that to figure out, are there barriers to even just that kind of level of the application process that keeps customers from going into the program. So there's a whole host of things depending on the program.
Great. Thank you so much, Laura.
Thank you.
All right. That was really great, really interesting. I'd love to read the whole study someday. All right. Up next is Jamal Lewis. So Jamal, you can get your slides ready. Jamal is a policy and technical assistance specialist at the Green and Healthy Homes Initiative. And he is the lead for GHHI's energy efficiency portfolio, and he works with several jurisdictions around the country to help incorporate best practices into their energy efficiency and lead poisoning prevention programs and policies. In addition, Jamal is also an active participant in both the Network for Energy, Water, and Health and Affordable Buildings, or the NEWHAB network, and Energy Efficiency for All coalitions, where the goal of those is to increase the accessibility of clean and efficient energy resources for the low-income population. And with that, I will turn it over to Jamal.
Hi, can you hear me?
I can.
And do you see my slides?
I do. It is showing the presenter side rather than it's showing
it
the side with the next slide is showing.
Hold on one second. How's that?
Perfect.
Cool. Thank you all for having me. I'm really excited to be here and also excited to hear from our other speakers today. I work for the Green and Healthy Homes Initiative. We're an organization dedicated to advancing a healthy, safe, energy efficient, and affordable housing for everyone. And my role specifically is working to advance both energy efficiency and healthy housing policies and programs across the country. So I will get going on my slides. So we know that energy is a big issue for a lot of people. These are some numbers pre-COVID. Energy insecurity, energy burden is something that impacts a lot of people. Over a third of people have in the United States have unreliable service. So this is a really widespread issue that we have to address, and so I'm really glad that we're having this conversation here today. So energy efficiency. So GHHI, we approached this issue from a comprehensive perspective. So pairing energy efficiency with other things like weatherization and healthy homes work to alleviate mold, lead, other health and safety hazards to maximize the benefit. And back in 2018, we published this report on here on the left, which just outlines the broad benefits that can accrue as a result of a comprehensive approach to energy efficiency, healthy housing more broadly. So if you want more information, you can check out that report that's on our website. So while we know that energy efficiency can provide a widespread set of benefits, the entire gist of today's conversation is the fact that there are barriers, and not everyone has access to to actually benefit from these programs. So I am going to try to talk about some of those barriers, but I'm going to do it in this context. So just last year, I worked with Carlos Martin at the Urban Institute to do an analysis and more of a theoretical review of how equity can be measured in energy efficiency programs. And in that report, we highlighted sort of these 6 dimensions that I'm going to talk about. And so the barriers and opportunities to address those barriers that I'm going to talk about are going to come in the context of this report. So the first is understanding historical legacies. That means when thinking about energy efficiency and how that can benefit certain communities, certain households, and thinking about the barriers that exist there, we have to consider, and we should consider, the legacy of maybe the utility with their community or the utility with a certain subset of people. And that is something that, you know, I don't think utility companies or energy efficiency programs do writ large. In really understanding those barriers, digging back and understanding why it is, or what events may have led to the fact that there's a lack of participation, as Laura mentioned in her talk. So these are some of the ways that historically certain populations may not have access or may not participate in energy efficiency. And you know, for renters specifically, they may not have the best relationship with their utility, given that they may be prone to shutoffs or other things, and we know that shutoffs can sometimes lead to eviction. So for renters, that's a particular barrier that exists that we have to address. I just want to point out this publication here on the right. I worked with Dr. Diana Hernandez and Dr. Arlene Geronimus. Diana is at Columbia, Arlene's at the University of Michigan. And what we did is we did an analysis of the different ways that the African Americans are disproportionately impacted by the energy system. So if you're interested in that, you can check out that publication there. The next sort of dimension is awareness of populations. And so building off of the last dimension, there are certain people that might have a harder time accessing these programs. And as was illustrated in Laura's talk and what's clear from RAL's most recent report is that residents of affordable housing and renters both have a higher energy burden, which means they pay more for their energy as a proportion of their total income. And so really getting a sense for who it is that we need to target services to, who do we have to give a little extra effort to reach. And so I just want to highlight New York State is going through the process of developing a plan to reach the state's pretty ambitious climate goals. And as a part of that law, you can see from this picture on the right, 40% of the overall benefits of spending on clean energy and energy efficiency programs have to accrue in disadvantaged communities. And so there is a task force designed or that was created in order to actually define disadvantage, what a disadvantaged community is. And so the state of New York is going through the process of being aware of the populations that need targeting of investments of clean energy and energy efficiency investments. And part of that will include renters. The next dimension is inclusion of other voices. Oftentimes, again, just echoing what Laura said, there are barriers that program administrators aren't aware of. And so it's not only important that we troubleshoot and find ways to increase participation, but part of the way that we do that is to make sure that people from impacted communities or potential participants in programs are involved in the actual planning of the program. And that's something that, I don't think happens nearly enough in the field. But I do want to highlight what happens in California. The Public Utility Commission there actually provides, not the public, there's a law passed in California that provides compensation for anyone of the general public that wants to intervene in the processes that ultimately decide how programs are designed and run. And that was a law that's passed. And so that eliminates a huge barrier to participation in the solicitation of feedback from impacted communities, people who could stand to benefit from these programs. And I think that's a model that should be replicated in other settings as well. So access discrimination. I mean, there's so many different reasons why renters, residents of affordable housing don't have the access to these programs. And Laura has outlined some of those barriers, Ariel in her report. But one of the reasons why from my experience is that for renters or for residents of affordable housing, we know that the income level for these folks is often lower than the general population, and so specifically renters of affordable housing. So there's a whole host of other programs that are income eligible or income qualified programs that we can directly make referrals from. So there's programs like Medicaid, which is an income eligible program, SNAP, WIC, and all of these programs provide critical benefits and critical services to income qualified residents. But there isn't the infrastructure to be able to access that information and that data. And so that's why I really want to highlight this initiative in Michigan with our partners there at Sierra Club, who reached as it says, a groundbreaking deal, and that was to connect recipients of energy bill assistance and funnel those folks directly into the energy efficiency program. What we know is that the application process can be really cumbersome, and so if there's any way to sort of funnel folks into programs, it alleviates a huge barrier. The next is output differences. So how many people actually participate once outreach is done? And I know this wasn't specifically a part of Laura's talk, but one of the reasons why folks sometimes don't actually get the benefit of the program, of the energy efficiency services, is because of the state of the home and the fact that there may be health and safety hazards that prevent the energy efficiency work from being done. And that's a huge barrier, particularly of historically disadvantaged communities that are living in homes that have been disinvested in for a long time. So I want to highlight in an initiative that New Jersey that we've advocated for years, but they're just now starting to put in place a whole house pilot, which combines the state's lead poisoning and healthy housing programs with the state's energy efficiency infrastructure to alleviate that barrier. So it's a really important model that I think, again, should be replicated elsewhere. And the last dimension that I'll talk about is the impact. This is the dimension that we know the most about. How much does energy cost for certain people? What's their consumption, energy burden? And so one of the things you can do is do an analysis of who is receiving the actual benefits of programs. And in Maryland, this year, I'm working with partners to ensure that the low-income population actually does have access to benefits. And we're doing that by trying to put in place a low-income savings goal for the energy efficiency program. And so my last slide here is just to highlight my colleague Margarita, who works out of Providence, and highlight the good work that she's doing. And I'll leave this slide up for folks to read, but that is it. I will leave it there.
Thank you so much. Ooh, some echoes. Does it sound echoey? Okay. Thanks so much, Jamal. That was a really great presentation. I really value the report that you published last year that you were using as the structure for this. I reference it often. It's really well thought out and helpful. I see one question or two questions in the chat. I think we have time for a couple quickly. One person asks if Michigan has a specific platform to streamline access to energy efficiency and other services that people may be eligible for. Are you familiar with that at all?
Can you still hear me? I don't know what happened. Oh, is my screen still being shared? It is.
It is, yeah. There we go.
I was trying to figure out what was happening there. All right. So no, there's no platform for all of the programs, but what's happening is this is a pilot. So I think they'll learn from this experience. But they are funneling folks who are receiving LIHEAP funds essentially into the energy efficiency program. So I think it's a matter of a database of folks who receive their energy assistance dollars, and just sending that database or that data over to the energy efficiency program.
Great.
That is a good idea. I mean, that's something that I know that you've advocated for, REL, and a lot of folks advocate for is a single database that can tell someone all the different programs that they qualify for.
Yeah, streamlining those offerings can really be helpful to address some of those barriers. All right, I see two, I think, quick questions. One is asking what the name of the whole home program at which, and which level of government do you work with? I think did you mention a specific whole home program?
Yeah, so the whole house program. Sorry, what was the question there?
Let's see, the name of the whole house program that you mentioned, and they're asking which level of government you work with. So I guess do you work federally, state, local?
Yeah, pretty much all levels of government. Myself and the sort of the team that I work with works mostly with local and state, but we have a federal policy team as well. And the whole home program is actually, it's called the whole house program, and it's also a pilot that New Jersey is putting on this year. So it's in the process of being developed right now.
Great. All right. And then one more question. April Paronish asks, with regard to the 550% you mentioned, what income level was used for low income customers, such as 200% of poverty?
Yeah, it's that 200% of the federal poverty. Yeah.
Okay.
That's for the state of Maryland.
Awesome. All right. There are a couple other questions, but I think we'll need to move on at this point. But thank you so much, Jamal. And I'm not sure if you're able to answer them in messages directly to people. Maybe you can do that.
Yeah, we'll try to do that.
Awesome. Great. All right. So now for the last part of the webinar, we're going to have a panel with 3 speakers. I'm going to introduce all 3 of them now, and then they'll each speak, and then we'll answer questions in the form of a panel at the end. So if you have questions for a specific person or for all 3, feel free to submit those. All right, so the first person we'll be hearing from is Terry Wright. Terry is a tenant and homeowner association organizer with the Direct Action for Rights and Equality. Terry works to make sure that, or her organization works to make sure that affordable low-income housing exists in our BIPOC and LGBTQ communities and is of service during unlawful evictions, landlord disputes, and making sure housing is safe. Terry is also a member of the Racial Environmental Justice Committee, whose work is aligned with housing, healthcare, and environmental racism. And Terry believes that homelessness is everybody's business. Our second panelist is Richard Weinberg, who is a manager of alternative energy at the Providence Housing Authority. Richard has been involved in alternative energy since the early 1970s while studying architecture at RISD. His career has been diverse with expertise in construction, computer programming, and data analysis. Richard's role at the Province Housing Authority analyze our utility usage and make recommendations for efficiency. The goal is to provide a better environment for our residents. And then lastly, we'll hear from Karenelle Legrand, who's a program manager at Housing Works Rhode Island at Roger Williams University. Karenelle she works to align, braid, and coordinate information, resources, and services for improving the health, safety, and energy efficiency for all Rhode Island homes. Prior to joining the team at Housing Works, she managed Connect for Health through the Lifespan Community Health Institute. She believes health equity is possible for Rhode Island through interdisciplinary advocacy and coordination. And with that, I will turn it over to Terry to give the first remarks.
Can you hear me okay?
I can, yes.
Okay, I'm going to start by, I'm Terry Wright, and I'm representing DARE. We are a non-profit organization which established itself in 1996 for the community, by the community. Community members fighting for basic rights in the community. We fight for housing justice. Older homes are typically more expensive to maintain. 74% of Rhode Island's housing stock built before 1979. The third oldest housing stock in the country, which is a barrier to low-income affordable housing and our most vulnerable low-income Black, Indigenous, and people of color and marginalized communities. Many are energy burdened due to high energy costs and barriers to maintaining homes. The oldest homes here in Rhode Island are not energy efficient, most of which require major rehab or demolition. We are left with a reflection of an unhealthy vacancy rate. This is as important as our low-income affordable housing demand. Before the COVID-19 recession, energy bills put a strain on family budgets, from bad insulation to outdated heating and cooling systems, asbestos, and mold in the walls of older housing stock and landlord properties that landlords refuse to update to efficiency with utility bills. Bills are high, economic options are limited, and energy efficiency should not be one of them. We are the only state in Rhode Island without a fund for low-income affordable housing, a fund for building and rehabilitating some of the oldest housing stock and homes and buildings around the city. Today, eviction courts are filled with tenants and homeowners seeking protection from foreclosures and evictions. Homeless families living in hotels and uncertainty, some with hotel vouchers, others without vouchers, in need of assistance. With the CDC declaration that ends on December 31st, tenants are still being evicted, homes are still being foreclosed on. The aid out there is just not enough. I just want to add, with a grassroots vision of energy efficiency homes, solar panels, and energy efficient appliances. Energy is fundamental for modern life in our homes, our businesses, and transportation, and the energy that powers them to reduce impact on the environment.
Great, thank you, Terry, for those remarks. Next up, we have Richard.
Had to hit unmute. Thank you for having me on. It was great hearing the presentations of Jamal and Laura. And Ariel, thank you very much. And Kate for putting this together. It's a great opportunity. And different than the other speakers, I'm actually focusing on one entity, which is the Providence Housing Authority. My background is diverse, where I'm aware of many different kinds of energy efficiency in terms of buildings, affordability, other construction materials. But right now, I'm with the Providence Housing Authority. Click. All right. Now, to me, it's very important to make the distinction of what public housing is versus that of affordable housing, because we're actually dealing with individuals who are in the society who, for whatever reason, don't have the resources to go out and find an apartment that would be of their choosing. And those reasons can be multifold. In addition, the Providence Housing Authority wants to maintain and does, they do an excellent job of making sure that the units are clean, maintained, and we've been through, over the last maybe 10 plus years, lead remediation, as well as asbestos removal and mold remediation. So they've been concentrating quite a bit on keeping the environment healthy. And with that, as an architect, I consider an environment to be key and critical to one's well-being. And I have to interject or add a program that we have, which I consider it to be one of the most valuable, which is called Resident Services, where we offer job training, we offer classes, language, literacy, and so much more, even how to own a home. And I'm not part of that program, but I see it across the asphalt parking lot. So one of the biggest barriers within our own facility is basically the fact that we're dealing, and other people have mentioned this, older housing stock. And a lot of our facilities were built actually for returning GIs from World War II. And our facilities go back to the 40s and 50s, where you don't have central mechanical systems except maybe heat. And it's very hard to regulate and control what I would consider a very decent environment inside of a unit. I mean, I think our tenants make the best of it, but we also, and we have an excellent director, Melissa Cinzaro, and she really emphasizes to the group of people that work there that they are the ones that keep us going, our tenants, and we have to keep them going. And I'm sure a lot don't want to be there, but several of my colleagues over my professional career had been at the Providence Housing Authority, and they've done very well. And maybe that's why I look back at or look to the Resident Services program with their educational component that helps allow tenants to move forward with a better paying job, or sometimes their first job, and get an apartment of their choice. But that's kind of been heartwarming. I'm retired, so I like what I do, and I like the Providence Housing Authority, or I wouldn't be staying there. Okay, next. Okay, limited funding opportunities. We have a capital fund that comes from the federal government, and it's the formula is somewhat, well, I don't participate in the formula, I participate in the reporting, but it's never enough. It allows us to maintain our units, replace broken appliances, make minor capital improvements. But the more we save with respect to energy, actually, the smaller our next year's allocation will be. And that is not good, because that takes away the incentive to save. There are a few handful of exceptions to that, to which we have partaken in and are going to continue to partake in. And one of them is an energy service EPC, which is an energy performance contract. And the other is solar net metering, where we're buying green energy so that our electricity costs will drop. And HUD has just allowed us to save the incremental difference. So, and that we can put towards capital improvements. But it was in actually a study that Ariel wrote that I saw that for us to improve nationally 1.1 million units that are in of the older housing stock to something much more contemporary and efficient would take over $4 billion, or maybe 4.5. I'd have to turn away to take a look at the notes, but it's really astounding, and we don't get that kind of money. So, okay, next. And our goal, once again, is to make sure that we have safe housing, and we have some nice amenities, including playgrounds and parks, water parks. So we do our best to try to make sure that the tenants feel comfortable. Next, click twice, actually, I think. All right. These are the improvements that we've made to date. Some I have mentioned: lead abatement, mold remediation, LED lighting, and all of these we try to monitor, at least especially when it comes to something that is quantitative, such as the lighting. Also the energy efficient boilers. It's not just the heating system. It also would include a energy efficient burner. Our energy performance contract and which has resulted in a lot of items, including reduced water usage and reduced electrical usage. And I'll end on maybe the note that an energy performance contract is where we've had an entity come in, do an independent study of what we need, and then we take the most cost efficient improvements that have the highest benefit and put those out to bid as one construction project. And we pay for that over 20 years with funding that we ordinarily would not have. And over those 20 years, we have the increment we save with the vendor that did the construction work. So it's a very big incentive. And we monitor all of our energy. We try to get the grants. And I have to put in a plug for RISE and National Grid, because they have been excellent to us. Okay, I think I had my 2-minute warning 2 minutes ago. Should I pause at this point and take questions if there are any? Ariel?
All right. Yeah, thank you. Thank you, Richard. I think we're going to hear from the last speaker and then do questions at the end for the whole panel.
Okay.
So thank you so much for sharing all of those points. All right, so now we're going to pass it over to Karenelle to speak. And please remember, if you have questions for any of the three panelists, to submit them to the Q&A and we will discuss them shortly.
Hi, everybody. I have the burden of going last, meaning I'm probably going to be repeating some of the information that was already given. So bear with me, but I hope to keep you all awake in the meantime. So my name is Karen Legrand. I work for the Rhode Island Alliance for Healthy Homes, which is a project based out of Housing Works Rhode Island at Roger Williams University. The mission of the Rhode Island Alliance for Healthy Homes is to work to coordinate policy where housing, health, and energy meet. The picture that you see of these happy smiley faces are some of our founding members, which include Green and Healthy Homes, the Rhode Island AG's office, Rhode Island Housing, as well as Department of Health's asthma program folks. We have come together to put together some policy tools for the use of other folks looking for grants so that they're able to look back at our information that we've gathered through either research or through some great folks coming together to help us write briefs. So we have a lead brief. We also have a packet of information that we've given to the City of Providence to talk to them about how to improve the housing conditions of the tenants living in the city. Also want to direct you to our housing fact book, which was recently updated for 2020. And I'm going to, at the end of my talk, give you a link in case you'd like to look at that as well. And some of the information I'm going to talk to you about next will come directly from that report as well. And let's see, last but not least, we'll talk a little bit about the existing conditions in Rhode Island. And again, this is all coming from our housing fact book. I want to start by saying that the reason why a lot of our utilities are unaffordable in Rhode Island is because our renters are extremely cost burdened. We know that about 27,000 of our lowest income renter households are paying over 80%, paying over 50% of their income towards rent. And that means that they have less funds to go into utilities. Many times they're having to make those tough decisions between paying their utility bill this month or daycare or even food at this point. So Rhode Island also has a third largest housing stock, which Terry mentioned. We are looking at our housing stock, particularly right now through this talk as well, because it makes it very difficult to improve some of the housing stock through weatherization funds, or even through the lead programs for lead abatement, because our housing is so old, is deteriorating to the point where even if we went in and tried to do insulation or some rehab work, we're going to find that there's still knob and tube in the walls, and we're not able to do the rehab work to get those houses where they need to be. So we have a very high need for funding of healthy homes in Rhode Island. 90% of our homes are also depending on fossil fuels, which makes our goal of having 100% of our homes running on energy efficiency a very lofty goal. The majority of that housing stock was not built with adequate heating system or cooling system in order to maintain thermal consistent temperatures during the summer or in the winter. This causes a heavy economic burden and health burden for our residents who might be at risk of having chronic health conditions that are exacerbated by having a lack of thermally controlled environments in their apartments. We see this through the Department of Health report that let us know that there's an increased rate of hospitalizations due to heat stress illness. It's reported that there was 11 in 2017, and that spiked up to 15 in 2018. We probably won't get a good reading about 2020, since we know folks are trying to stay away from hospital departments and emergency rooms due to fear of getting COVID. But there have been, for sure, an increased burden due to heat stress to folks living in those apartments. Next slide. So as the Rhode Island Alliance for Healthy Homes, through Healthy Homes Green Initiative and other folks, we've come together to put together a tool to assess the health of our homes. We have done that through a tool called One Touch. It not only assesses the health of the home, but also links them to existing programs that can help them find either the funding or the advocacy needed for them to rehab that unit. We worked with Clear Results in order to connect with some of the weatherization programs and the funding that is available through our CAP agencies, as well as city funding and Rhode Island housing funding that is available for families. We also, aside from just doing a connection or an assessment of energy, heat, needs, we do other basic need questions like, are there enough other resources in the home, like food available for the family, and we'll connect them to food banks at this point as well. Next slide. This just sort of wraps up my piece by giving you my contact information. If there are any questions, I'm happy to also answer those through the chat box later. Thank you again for the opportunity to speak today.
Great, thank you so much. All right, so now we will open it up for a Q&A for the three panelists. I saw one question come in so far, which I think is directed towards Richard. Jeffrey Berg asks about carbon taxes and if you've considered using carbon tax revenues to invest in renewable energy assets for affordable housing residents. And do you have any thoughts on that?
You said carbon taxes.
If you have any thoughts on carbon taxes.
I realized I'm unmuted now.
Yeah.
I'm very familiar with what that is, but we're also very restricted as to what we can do as a federal agency. And honestly, I do not know whether carbon tax is something that we could participate in, but it's something that I can mention. I mean, it took almost 6 years before we could when we saved energy with solar, before we could actually participate in the savings. So the federal government, I'm not saying they take a strict approach, but they take a very metered approach and a very slow one to make sure before they introduce a new tool. And being familiar with the carbon markets from maybe 10 to 12 years ago, they were very volatile. And that might have been more the speculative side than what you're referring to, but it's something that it's nice to hear that it's still alive, carbon tax.
Yeah, it looks like I didn't read Jeffrey's question correctly. He specifically, sorry about that, was asking about using carbon tax revenues to purchase renewable energy assets and then issue microstock to renters and affordable housing residents, and then get the output represented by the stock they own. So I guess being able to use that carbon tax to invest within the affordable housing. So I think you've basically answered the question, but if you have anything else you want to add to that.
No, I mean, from what I know of the regulations that we've been through when we want to try to implement a program or take advantage of another one, it's really complicated, and it's even becomes more complicated as if somebody is going to go independent. Because right now, the funds that come into the Providence Public Housing Authority, and we cannot direct those to the tenants. Mm-hmm. We can't even initiate a energy sharing component, meaning if we were to monitor their energy usage and temperature, we cannot provide an incentive back to that person. So we really are the ones that have to take charge of how we control the energy going in and save as much as possible so we can put as much back into the infrastructure.
Awesome. Thank you, Richard. Great. All right. So another question came in asking if the panel can talk more about how to bring together funding from different sources, such as health and energy efficiency programs, and what types of measures or projects would best combine the benefits.
Well, one of us has to start. Maybe as far as outside funding, we're almost dependent on the federal government, but where that benefits us is if it wasn't for some of the regulations for, let's say, lead abatement and asbestos removal, I doubt that we would have had the funding made available to us to accomplish that task. And when it comes to energy, that's where National Grid and RISE step in, as well as the City of Providence with Community Development Block Grants, where they might try to offer money for very specific tasks.
Hi, I'd like to talk about a little bit of a pilot that we've run this summer, which I think highlights the potential to incorporate funding and align and coordinate both energy and health. We, in early June, decided to quickly put together about 40 air conditioners that we wanted to give out to folks who were stuck at home. We had the stay-at-home orders affected folks who traditionally had gone to cooling centers for the relief of heat in the summer. And we partnered with Providence Housing as well as One Olneyville Housing. We braided funding from Blue Cross Blue Shield as well as Rhode Island Department of Health funding to purchase those air conditioners. We are now working on a brief evaluation to see how that went for the families who received the air conditioners, and we'll report back to Blue Cross, which is a health insurance company here in Rhode Island. Our hope is that that information then gets us to go into a bigger pilot in the summers to come to have health systems and health insurance folks recognize cooling and air conditioners as a medical equipment need that would be reimbursable through health insurance.
Great, thank you. Terry, anything you would like to add to this question? And if not, I'm also going to open up the Q&A back to Laura and Jamal as well. So if either of you have thoughts on these questions, feel free to also chime in. Not to put you on the spot, but anything you'd like to add, Jamal, to this question about health and energy efficiency?
Yeah, excuse me. Yeah, I thought Carnell did a really good job of describing that. I mean, from a big picture standpoint, which I think Carnell was talking a little bit about, there are, one of the main barriers that we talk about is the health and safety, and I know that has been hammered home through the panel. The fact that there's older to deteriorated housing that can't actually access clean energy programs or energy efficiency programs because of that, and so oftentimes the energy programs don't have there's no resources in the budget to be able to address, which I know has been talked about. But what we're seeing, and that's why I highlighted the whole house program, is the aligning, rating, and coordinating of resources that exist for healthy homes and resources that exist for energy efficiency and weatherization, and really trying to align them so that we can maximize the benefits of both programs for the household. And so the good thing is that out of the Department of Housing and Urban Development this year, based on years of advocacy from advocates like GHHI, HUD had released its first ever funding opportunity that supports coordination with DOE's Weatherization Assistance Program. And so, the application is open now. They're gonna award 5 jurisdictions at $1 million each. And it's really to pilot this idea of the coordination. And we believe that there's going to be another opportunity to apply next year. And so this is really an opportunity for local and state entities to really build out that infrastructure to support better coordination, because we believe that this model is here to stay. And I think we're going to see more of it from the federal government.
That's great. Thank you. All right. Let's see. Karenelle, there's a question for you specifically, asking if you can expand at all on the process of using funds from an insurance company for a health and housing intervention.
Yes. So for us, it was actually a grant that was given through Blue Angel Fund, through the Blue Cross and Blue Shield. We did, though, however, approach other local agencies and the Medicaid office, and they were all like really eager to work with us. It was just like through a funding proposal that we came up with, even though they didn't have like available funding, we let them know that it was an issue. So it's just, and we're also lucky in Rhode Island, as you know, that we're a really small state and people all kind of know each other. And my director, Brenda Clement, was already on a committee with Blue Cross and Blue Shield and knew of like the potential fund. So it's a lot of networking and, you know, braiding our time and resources together to work for the greater good. I hope that is specific enough.
Awesome, thank you. All right, we got another question asking about the Rhode Island PACE program. They ask or say that the PACE can provide nearly unlimited funding to provide energy efficiency upgrades that are self-amortizing. Why isn't the PACE program seen as a source of funds to tackle this huge need, or is it? If anyone has thoughts on PACE.
My take on PACE is, I mean, I think it is a really good opportunity to bring financing to an issue that needs to happen urgently, particularly as we think about the need for us to address climate change. And so, you know, I think PACE is a really good tool for that. What I haven't seen is PACE being used to address some of the macro housing condition issues that can prevent the large scaling of energy efficiency, particularly in older housing. I mean, I think it's worth exploring, but from what I know, it's mainly about the financing of energy efficiency and how that can be paid off over time through assessment of the property.
Mm-hmm. That's a good answer. Anyone have anything to add? Okay.
If not, I can also just piggyback on Coronel about health insurance company funds. We've found that obviously energy efficiency and healthy housing both improve health in different ways. Healthcare entities really want to help their bottom line, and so a lot of times that involves reducing hospital visits or reducing ER visits, things like that. And in our experience, we know that asthma is one of those preventable conditions that has a really tight intersection with poor housing conditions, and particularly with the presence of mold or other asthma triggers. And so we have a number of pilots and projects that are supporting trying to open up that pathway for, you know, either whether it's a hospital or a health insurance company to pay directly for remediation of mold or ripping up a bit or things like that can, one, benefit the occupant by reducing their exacerbation of their asthma symptoms, and two, can alleviate a huge barrier to accessing energy efficiency. So it's something that we're working on, and I know, Coronel, that you work with Margarita and you all are exploring that too. So I just wanted to echo what you were saying.
Great, thank you. All right, we got another question asking if there are any statewide, so I would guess Rhode Island or elsewhere, job training programs that address all of the issues that have been mentioned today, such as housing, energy efficiency, lead, asbestos abatement, weatherization, etc. So does anyone know of any good examples of comprehensive job training programs?
Jamal will probably know a little bit more than I do, but I know that Margarita and her team here at Rhode Island do have a job training program available through RHEBA, I believe, and that are specifically training folks on lead abatement and trying to diversify the workforce as well, in order to have more Black and Latinx folks participate. The way that she is coordinating those trainings is by offering it in Spanish and other languages to encourage other folks and communities to participate. Rhode Island Housing also has a lot of job training programs available, I believe, in weatherization and lead abatement as well.
Great, thank you. Anyone else want to add to that, or any other examples?
We had several examples, probably going back 10 to 12 years, and I think they lasted through maybe 2014, and they were in multiple trades, because I know the Housing Authority was active in trying to get residents who were interested enrolled. I am not familiar with any now, short of what is within the Housing Authority. Mm-hmm. And for those that don't know, I'm not sure, Carrie and Al, if you meant as for those not in Rhode Island Builders. Is that what that? Okay, I just thought it's a very important organization here in the state, but this is the first time seeing a national audience. And by the way, Laura, I miss Madison. All right, I'm going to unmute myself.
All right, great, thank you. All right, I see one more question where the person is asking if there are any examples of partnerships with environmental groups that are funding energy efficiency or carbon reduction projects. And they say, for example, like the Nature Conservancy or other carbon reduction funding programs. Is anyone aware of any examples of this?
I'm not.
The Providence Housing Authority has been approached by different groups. Most of them are for-profit. There is one, and unfortunately, I don't remember its name, but they're trying to help get us involved in a net energy metering project. So, but they're out there. It's just who they focus to.
Yeah, I would say I don't know of any large environmental organizations that directly fund efficiency. A lot of them do work around policy and advocacy, but there are smaller nonprofits that do fund energy efficiency programs and carbon reduction. But maybe that's something that some of these organizations can focus more on in the future. All right. Oh, there is another question that just came in asking if anyone has experienced overcoming the landlord-tenant relationship barrier and or tools for convincing landlords on the return on their investment. What about different types of landlords, such as local versus absent landlords as well? It's a great question.
I would say more through my days working at Lifespan with their Connect for Health program, ran into a lot of individuals who were very, very afraid of retaliation against their landlord and decided to either vacate properties that had terrible conditions or just live with it. And my advice to them over and over was not to go into the conversation adversarially and instead look at their landlord as a partner. A lot of the landlords in Providence are pretty moderate to low income themselves, and to kind of reverse the roles there, not to put the burden on the tenant, but also just to have them be able to present the case to the landlord without feeling like they're going to have to fight their landlord in court. And in doing so, arming that tenant with the landlord-tenant handbook so that they know their rights was really important. But also letting them know there's a lot of resources in our state. And I want to say a lot because I feel like it's a lot, and I know that they still lack a lot of funding and support. But there are enough programs, I think, that folks just don't know about. So again, like the lead abatement programs through the Rhode Island Housing, there are even home repair funds. So that could help a landlord repair something like a costly leaky roof that is leading to mold and other unsafe conditions in the home. So my first thing is always to tell them, like, you are a partner here with your landlord. You don't have to take them to court. If you do want to take them to court, we do have, we can connect you to services that will help you there. But first, it's just letting them know, here are all the list of programs that offer healthy homes funding, and just go to your landlord saying, you might not be fixing this because you don't have the money right now, but there are some either low interest loans or free programs and grants that can help us fix this together.
Great, thank you. We're almost at the end of time, so I'm going to pass it back to Kate. And there was one final question about the slides, asking if they will be made available to people on the call. And I'll pass it back to you, Kate, to introduce the closing remarks.
Thank you so much. Thanks to all of you for participating. It's always really inspiring to hear people talk about what they love and work so hard to impact. And so thank you for sharing your knowledge with all of us. There was a great hearty group of folks here. And speaking of which, this session will be recorded and posted on the URI Cooperative Extension YouTube page within the week. So if anyone has colleagues that would be interested in viewing this session, please direct them to that YouTube page. I will say a few more things before we go, but first I would like to introduce my dear friend and colleague, old friend and colleague, Rachel Shawley, who is here representing Optimal Energy, which is the consulting firm that assists the Rhode Island Energy Efficiency and Resource Management Council with a lot of different things. And Rachel is going to talk to us about how all of you can engage with the EERMC and their process so that we can raise the voices of those who aren't here tonight.
Sure, and I'll be quick. Thank you, Kate. Can you hear me okay?
Yes.
Okay, great. So as Kate said, I'm Rachel Shalley, and I am a consultant to the Rhode Island Energy Efficiency and Resource Management Council, which is sponsoring URI's Energy Lecture Series this year. So the council is really excited to be supporting this series of conversations around energy efficiency and how it intersects with housing, with health, schools, and COVID-19. For those who aren't familiar, the EERMC was established in 2006 to oversee procurement of energy efficiency in Rhode Island and to make sure that all Rhode Island energy consumers get the maximum benefits from energy efficiency programs. So the council consists of 15 governor-appointed members representing small and large business, homeowners and renters, nonprofit organizations, municipalities, environment, codes, and energy regulation and law. And we have meetings every month that are open to the public. They're virtual now, so anyone from across the country is welcome to join. And we encourage any and all members of the public to come and participate in this energy efficiency planning process for the state. You can also learn more on our website, which is rieermc.ri.gov. And on behalf of the council, thank you so much for joining us tonight. And thank you very much to all of our speakers who joined from all over the country. And I'll pass it back to Kate to wrap it up.
Thanks so much, Rachel. So thank you again to all our speakers. And I, on behalf of URI, want to thank the Energy Efficiency and Resource Management Council for providing us the opportunity to curate these lectures. It's been really enlightening and has actually inspired us to continue sharing the complex nature of the energy sector with the public. And so with that, I would direct your attention to two webinars we have coming up on December 1st and December 8th. These are offered through Cooperative Extension's Learn at Home webinar series, which we put together when we were not able to meet in person anymore back in April. And so since then, we've offered over 40 webinars every Tuesday at 7. Last night, we had one on indigenous plants from a Narragansett perspective, which was really interesting. On December 1st, we will hear from Wheezy Nora, who many of you probably know. She's now at Dominion Energy, was at ISO New England, the grid operator. She's going to talk about wires and demystifying New England's energy infrastructure, which is something those of us in the field understand, but not many others do. And so we're really excited to have Wheezy speak. She's a great speaker. Hope you all will join us for that. These are free webinars, Tuesdays, 7 p.m. The other webinar we have planned is also really exciting, building on what Wheezy will talk about energy infrastructure. We will have Dr. Todd Bianco and Emma Rodvian, who are both currently at the Rhode Island Public Utilities Commission. They're going to share some information about the PUC here in Rhode Island and what the PUC does in terms of utility regulation, and also what's on the horizon in the future as we diversify the grid here in New England. And so again, you know, in addition to this conversation tonight, I think there's a lot to be talked about, and it's a prime time for all of us to sit, whether it's on our couches or at our desks, and learn more. So thank you to all of you who are here tonight. Ariel, thanks so much for moderating. Laura and Jamal, pleasure to make your acquaintance. And Terry, Richard, and Karenelle, thanks so much for all you do for Rhode Island. And until next time, stay healthy and safe, everyone. Good night.